I'm going to just scan my room. These are my supplies. I'm going to set up the camera. My name is Grace Davis. This is for the spring semester of 2022 for my head to toe assessment for the University of Memphis in the FMP program. I've already washed my hands and I've confirmed my patient identity, and I'm going to begin my assessment. I'm going to start by saying that during this assessment I'm going to be looking at the skin of the head, face, neck, anterior and posterior chest, and the abdomen. I'm going to be looking at it for its color, temperature, texture, turgor, moisture, edema, and any bruising, scars, levi, and lesions. I'm going to first look at the head. I'm looking at its size, shape, and symmetry. I'm looking at the scalp, assessing the hair distribution, color, and texture, and I'm going to palpate the scalp for any lesions, infestations, masses, tenderness, or depressions. Any tenderness?
No.
Okay. I'm going to go ahead and palpate the temporal arteries for tenderness. Any tenderness?
No.
Okay. I'm going to go ahead and palpate your lymph nodes, starting with your preauricular, your postauricular, the occipital, your tonsillar, your submandibular, submental, and your supraclavicular. Any tenderness?
No.
Great. I'm going to go ahead and assess cranial nerve 5, which is the trigeminal nerve, by assessing your motor strength of the masseter muscle when you clench your jaw. And now if you could open and close your jaw for me, I'm assessing the TMJ for any subluxation, crepitus, or tenderness. Any tenderness?
No.
Great. I'm now going to assess the sensory sensation of that cranial nerve 5, so if you'll close your eyes for me and tell me if you could, on your face you can feel this.
Forehead, cheek, nose, chin, cheek.
Great, you can open your eyes. And I'm going to go ahead and assess cranial nerve 7, which is the facial nerve, as I assess for symmetry while you smile, frown, pucker your lips, puff your cheeks out, and raise your eyebrows. Looks good. I'm going to go ahead and move on to assessing your ears. I'm looking at their size and symmetry. I'm palpating the tragus and the pinnae for any tenderness, masses, or lesions. Any tenderness?
No.
Great. I'm going ahead and I'm going to inspect the internal canal of your ear, and I'm going to be looking at the tympanic membrane. So I'm going to pull up here, and I can see the cone of light, and the tympanic membrane is pearly gray. I'm going to assess on this side as well. And same on this side. I'm going to go ahead and assess cranial nerve 8, which is your vestibular cochlear nerve for your sense of hearing. So I'm going to start by doing a whisper test. So if you'll cover one of your ears, I'm going to whisper something into the other ear, and you'll just repeat after me.
1, 2, 3.
And now do the other side.
A, B, C.
Great. I'm now going to do Weber's test for lateralization. So tell me if you can hear this the same out of both sides or just one.
Both.
Great. Now I'm going to do the Rhines test for to assess that air conduction is greater than bone conduction. So tell me when you can no longer hear this.
You can no longer hear it.
Can you still hear it?
Yes.
Great. And I'm going to do the same to the other side. Tell me when you can no longer hear this.
Can no longer hear it.
Can you still hear it?
Yes.
Okay. I'm going to move on to assessing your eyes. I'm going to be looking at the eyelashes, eyebrows, and the palpable fissures. I'm going to be inspecting the conjunctiva and the sclera. I'm looking for any lesions, discharge, or discoloration. I'm going to go ahead and assess cranial nerve 2, which is your optic nerve, by assessing your gross visual acuity and your central and peripheral vision. So if you'll hold this chart out in front of you and cover one eye and read the lowest line that you can.
D, E, F, P, O, T, E, C.
Great. Now do the other side.
D, E, F, P, O, T, E, C.
And now do both eyes.
D, E, F, P, O, T, E, C.
Great. And that is 20 out of 20 vision. I'm now going to assess your peripheral vision. So if you'll cover one eye and tell me when you can see my finger.
I can see it.
Great. Now the other eye.
Now.
Okay. And if you'll uncover both eyes and tell me when you can see my fingers.
Now.
Okay. I'm going to go ahead and assess cranial nerve 3, which is your ocular motor nerve. And I'm going to be assessing your pupillary response to both direct and consensual light. So I'm going to shine this light in your eyes if you'll just look at my nose. Great. I'm also going to assess for accommodation and convergence. So if you'll look at my finger, now look at the window, now look back at my finger and follow my finger inward. Great. I'm now going to assess, in addition to cranial nerve 3, I'm going to be assessing cranial nerve 4, which is the trochlear nerve, and cranial nerve 6, which is the abducens nerve, by doing extraocular eye movements. If you'll just follow my finger with your eyes and not with your head. Great. And now I'm going to assess the internal structures of your eye and for a red reflex. If you could remove your glasses for me. And I'm going to be shining this light into your eye. Red reflex is present and no abnormal internal eye structures, and the same on this side. Red reflex is present and no internal eye structure abnormalities. I'm going to move on to assessing your nose. So first, if you'll close your eyes for me, I'm going to assess cranial nerve 1, which is the olfactory nerve. If you can tell me what it is you smell.
Alcohol.
Great. And you can open your eyes, and I'm going to assess your nose for its shape and midline positioning and its symmetry, and I'm going to assess nasal patency, so if you'll include one nostril and sniff, and now with the other side. So you have patent nares. I'm going to go ahead and now move on to assessing your mouth. So if you could open your mouth for me, and I'm going to shine this light in, say ah. Great, and lift up your tongue for me. Okay, and while I did that, I was assessing your lips, your teeth, your gums, your buccal mucosa, your tongue, your palate, the floor of your mouth, your salivary ducts, your posterior pharynx, and your tonsils. If they were present, I would grade them. In addition, I just assessed cranial nerve 9 and 10, which is the glossopharyngeal and the vagus nerve. I assessed that the soft palate and the uvula rose symmetrically with phonation. And then I assessed cranial nerve 12, which is the hypoglyceal nerve, by assessing that your tongue was midline without any fasciculations. I'm now going to move on to assessing your neck. So I'm looking at the trachea. I'm seeing that it is midline. And then I'm going to palpate your thyroid gland, so if you'll swallow for me. Okay, and one more time. Great. I'm now going to palpate your carotid arteries. I'm now going to assess your carotid arteries for any worries, so if you'll take a deep breath for me and then turn your head that direction. Hold your breath. Okay, now the other side. And turn your head this way. Great. I'm now going to move on to examining your anterior and posterior chest. So I'm looking for any obvious deformities of your anterior and your posterior chest. And I'm going to also assess for any obvious signs of respiratory distress, which includes use of accessory muscles, nasal flaring, tripod positioning, retractions, tachypnea, or cyanosis. I'm going to begin with your posterior chest, so if you could help me face your back towards the camera. So I see no obvious deformities. I'm going to start by assessing for symmetrical chest expansion, if you'll take a deep breath. Great. And now I'm going to do tactile fremitus, so if you'll say 99.
99, 99, 99, 99, 99.
Okay, I'm now going to auscultate over your lung fields. Well, first I'm going to percuss over your lung fields. And now I'm going to auscultate. If you'll take a deep breath each time I move my stethoscope. Okay. I'm going to get your middle fields here. Great. Now I'm going to do egophony. You'll say E-E-E every time I move my stethoscope.
E-E-E, 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 E-E-E.
Great. And now I'm going to do bronchophony. If you'll say 99 every time I move my stethoscope.
99, 99, 99, 99, 99, 99.
Great. And now I'm going to do whisper petriloquy. If you'll whisper 1, 2, 3 every time I move. Your lungs were clear, and I heard no abnormalities with those 3 tests. So if you'll turn and face your anterior chest towards the camera. And now I'm going to assess for any obvious deformities of your anterior chest. I'm going to assess for symmetrical chest expansion when you take a deep breath. Great. And now I'm going to assess for tactile affirmative symmetrically if you'll say 99.
99, 99, 99, 99.
Okay, and now I'm going to auscultate your anterior lung fields. So take a deep breath each time I move my stethoscope. Great. I'm now going to move on to my cardiac assessment, and I'm going to begin by auscultating your valves, starting with the aortic valve, which is at the second intercostal space right sternal border, pulmonic valve, which is at the second intercostal space left sternal border, herbs, which is at the third intercostal space left sternal border, tricuspid, which is at the fourth intercostal space left sternal border, and then your mitral, which is at your fifth intercostal space midclavicular line. And then I'm going to do the same assessment with the bell of my diaphragm, starting with your aorta, pulmonic, herbs, tricuspid, and your mitral. I would also palpate for the point of maximal impulse right here, as well as I would listen to it with my stethoscope for a full minute to assess the rate and rhythm. If you'll go ahead and walk to the couch for me. As you're walking over, I'm assessing your gait to look for a regular gait. I'm going to move this camera. And you can just lay down for me. With the head of the bed at 35 to 40 degrees, I would be assessing for any jugular vein distension, which there is none present. I'm now going to re-auscultate each valve of your heart, starting first with my diaphragm. I'm also assessing for any heaves or lifts, aortic, pulmonic, herbs, tricuspid, and the mitral. And then again with my bell, the aortic, tricuspid, or pulmonic, herbs, tricuspid, and the mitral. I'm then going to feel for any thrills over each auscultation point, the aortic, pulmonic, herbs, tricuspid, and the mitral. I'm now going to be assessing your abdomen. I would be looking at the contours and the symmetry of your abdomen. I would begin first by auscultating. I'm going to start by listening for any bruits of the abdominal aorta. I'm then going to assess for any bruits in the renal arteries, the iliac arteries, and then the femoral arteries. I'm now going to auscultate for your vowel sounds, starting with your right lower quadrant, then your right upper quadrant, your left upper quadrant, and your left lower quadrant. You have normal active vowel sounds in all quadrants. As well as when I was doing your cardiac assessment, you had a clear S1 and S2 with no rubs, murmurs, or gallops. I'm going to go ahead and then percuss your abdomen, assessing for any tympany, dullness, or flatness. I'm then going to go ahead and start with a light palpation of your abdomen for any tenderness, so tell me if you're tender at all.
No.
Okay, I'm going to go into my deeper palpation of the abdomen. Any tenderness?
No.
Okay, I'm now going to assess for your liver and your spleen, so if you'll take a deep breath, I'm going to palpate your liver on the right side, and then your spleen on the left, which I cannot feel. Okay, now if you'll stand up for me, and when you walk back to the chair, if you'll walk back heel to toe, I'll assess your tandem gait. Which is intact, and then if you'll face with your back towards the camera, I will assess for CVA tenderness when you sit down. If you want to go ahead and sit down. Tell me if this is tender at all.
No.
Great. So you can go ahead and face the camera. We're going to now begin with the assessment of your extremities. So I'm going to start by stating that when I'm going to be looking at the joints of your fingers, your wrist, your elbows, your shoulders, your toes, your ankles, your knees, and your hips. And I'm going to be assessing those joints for any nodules, swelling, redness, deformities, crepitus, tenderness, and the symmetry of them. So I'm going to start by looking at the joints of your fingers, your wrist, elbows, and shoulders. And I'm going to go ahead and look at the joints of your toes, your ankles, your knees, and then your hips. I'm going to assess capillary refill of your fingers, which is less than 3 seconds, and I'm going to assess your radial pulses, which are 2 plus out of 3. As well, I'm going to assess capillary refill of your toes, which is less than 3 seconds, your dorsal-pedis pulses, 2 plus out of 3, and your posterior tibial pulses, 2 plus out of 3. I'm going to go ahead and do a hand grip strength test if you'll squeeze my hands. Great. And then we're going to go ahead and have you flex up against my resistance, good, and then push down. And that is checking the strength of your elbows, which is 5 out of 5. I'll have you push your shoulders away from me in abduction and then push them together in adduction to assess your shoulder strength, which is 5 out of 5. I'm also going to assess cranial nerve 11. If you'll shrug your shoulders up against my resistance, that's the accessory nerve, which is intact. I'm now going to assess the light touch sensation of your upper and lower extremities. So if you'll close your eyes for me and tell me where in your body you can feel this touch.
Right arm, left leg, right foot, right thigh, right shin, left thigh.
And that is intact. I'm going to go ahead and assess your cerebral coordination. So first we'll do a serial finger opposition, if you can go like this. That is intact. We'll do a hand flip-flop, so if you'll put your hands on your lap and go like this and slowly build up the speed. Great, and now we'll do finger to finger. So if you'll just use one hand and touch my finger to your finger. And now with the other hand. Great. We're going to go ahead and assess your reflexes. Starting with your brachioradialis reflex, your bicep, and your tricep. And then again, your brachioradialis, your bicep, and then your tricep, if you'll relax your arm. And then we're going to go ahead and do your patellar reflexes. And then your Achilles reflex. And then your Babinski. Intact. And Babinski's negative. And then we're going to go ahead and do a dorsal flexion if you'll push up, and then a plantar flexion pushing down to assess 5 out of 5 feet strength. And then with your knees to assess knee strength if you'll push against my resistance and then pull me back in, that's 5 out of 5 knee strength. With your hips, if you'll pull out and then push me back in, that's 5 out of 5 hip strength. I'm going to go ahead and assess range of motion. So starting with your fingers, if you'll flex your fingers in for me, extend and hyperextend, and then abduct away, adduct together, and then thumb opposition. Great. And then with your wrist, if you'll flex your wrist, extend, hyperextend, ulnar deviation, radial deviation, and then rotation. And then with your elbows, if you'll flex, extend, hyperextend. And then with your shoulders, if you will flex up and then extend and hyperextend back. And then if you'll abduct away, abduct across, and then internal and external rotation of each side, and then switch sides and show me that. Great. And then a rotation. Awesome. Now if we'll do the same thing with your toes here, if you'll flex your toes for me, flex your toes, extend, hyperextend, abduct your toes away, abduct them together. And then with your ankles, if we can do a flexion, extension, hyperextension, external rotation, internal rotation, and then circumduction. And then with your knees, if you'll, we'll do that standing up, so you can stay seated for just one more second. We're going to do grapthesia, so if you'll close your eyes for me, I'm going to draw a letter on your hand, and you tell me, or a number on your hand, and tell me what number it is.
1.
Great, and then with this hand?
4.
Okay, and then keep those eyes closed for me. I'm going to hand you an object in each hand, and you tell me what it is.
Coin. Marker.
Great. And now I'm going to assess your vibratory sensation over your ulnar, you can open your eyes, sorry, over your ulnar prominence, excuse me. And then also on your medial malleolus, do you feel sensation everywhere? That
Yes.
touch so far? And how about here?
Yes.
Great. Okay. And now if you will stand up for me, and I'm going to have you turn where your back's facing the camera, and if you'll flex downward for me, flexion of that cervical and lumbar spine. I'm assessing the spine for any tenderness, nodules, or deformities. I'm assessing for any signs of scoliosis, which there are none. Any tenderness?
No.
Okay, and then if you'll extend your spine and hyperextend your spine back, and then we'll do lateral rotation of both the cervical and, so go side to side for me, of lateral flexion the cervical and lumbar spine, and then a rotation. If you can rotate your spine for me. Great. And then if you'll turn around and face the camera, close your eyes and put your hands out. And that is a negative Romberg's. And then if you'll open your eyes and you can put your arms down and you can hop on one foot. Great. And now show me the other foot. Hop on that foot. Okay. And then we're going to do range of motion of your knees and your hips. So for your knees, if you'll flex your knee, extend and hyperextend. And then again with the other knee, if you'll flex, extend, and hyperextend. And now with the hip, if you will flex it back, extend, hyperextend, and then we're going to do an internal rotation, an external rotation, an abduct away, abduct across, and then a circumduction. And then we'll do the same with this hip, if you can flex it back, and then extend, hyperextend, internal rotation, and yep, external rotation, abduct away, abduct across, and then circumduction if you'll move around a circle. And that completes our exam. Thank you.